what is happening now. We are all greeting you.
Around 800 children, mostly in poor countries, die every day of AIDS-related illnesses such as TB. These children could still be alive if they had received better testing and treatment, or if transmission from their mothers had been prevented. A number of these women have lost children because of AIDS. Their husbands and partners have also died. In recent years, 42% of pregnant women in Swaziland tested positive for HIV. Dumsile's first child died from an AIDS-related illness. Her son, Buginkosi, also has HIV. Dumsile thinks her son got HIV through breastfeeding. She says she knew that breastfeeding could transmit HIV, but she had no other food to give her children. The challenges to treating HIV in poor countries can be massive. Children on antiretroviral medication must have access to clean water to take their medicines. A nutritious diet is also essential to strengthen their immune systems. Grace Shangasi, a Caritas community worker in the area, is visiting a woman called Thabisile, who lives in a remote hut with her 12-year-old daughter. She has TB. This is a common illness in people with AIDS.
Okay, come on. Yeah. Sorry.
Thabisile took an HIV test because 2 of her children had died. She discovered that a 3rd child had HIV. He died after she could no longer afford to pay for his treatment. Thabisile lives 45 kilometres from the hospital where she has to go to get her ARVs. It costs €2.60 to get there, and she doesn't always have the money.
They die because there are no means of transport here. It's very, very difficult to reach to the hospitals. So they are taken by wheelbarrows, or you just put them on your back, carry them to the hospital or to the nearest clinic, or if you've got hired a car. Otherwise, it's very, very difficult to live here. Besides hunger, the transport.
Around 5.7 million people are living with HIV in South Africa. It is one of the worst AIDS epidemics in the world. Plastic View is an informal settlement outside Pretoria, where Caritas provides care and ARVs for adults and children with HIV. In poor settings, doctors may not be able to accurately diagnose HIV in children below 18 months of age because they have no access to HIV tests adapted for use with infants. So parents have to return their children for a second test at 18 months. They don't always do this.
This one I made the test, but she was negative, but now I don't know why she's negative again or what happened.
The Thabang Society in Parys, South Africa, gives care for children and adults with HIV. Caritas provides the clinic with ARVs.
Because many of the children have to take, especially when they're small, they have to take the medication as a liquid. So the liquid has to be mixed at home, so you have to have clean water. Otherwise, if you don't have access to clean water at your house, you have to buy clean water or distilled water at the pharmacy, which is definitely expensive. And the second thing is that the liquid has to be stored in the fridge, whereas tablets you can store at room temperature. So meaning if you have a child on liquid ARV treatment, it's much more complicated.
The diagnosis of TB is also a big challenge.
For the children, sometimes it's very difficult to get the sputum out, so to cough and really to get the sample of sputum. So that's one main difficulty to diagnose children. So meaning sometimes in case of getting sputum, then you have maybe to send the child for an X-ray to state if she has symptoms for TB or not, which is also, of course, more costly, and then you have to have the facilities available.
Mosifo is 7 years old. Both of her parents are dead and she has HIV. When she came to the Thabang Society, she was very ill and had extrapulmonary TB.
We started the TB treatment. Normally you wait 2-3 months and then you start on ARVs. But for her it was quite clear that she was getting worse so quickly that we didn't have time to stick to those rules. So we discussed it with the specialists and he said, okay, put her on treatment. But you must be aware that she could go through a really severe phase. So we take her in one of our orphan homes and arranged for 2 home-based carers to stay with her day and night, and then we started her on the ARVs. So actually we were quite lucky because the little lady didn't experience a lot of side effects, so it was only minor side effects. So she went through the whole period quite well, and I think now she is even having her smile back again, and so now you can really see that she is getting stronger and stronger every day. So we see her now. She's went back to school, so she's back to the family, back to school. You enjoy school, Nosipo? You enjoy school? Yeah.
Despite the difficulties, preventing transmission from mothers to their children and early testing and treatment for children with HIV and TB means that lives can be saved.
Welcome, 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 welcome. We are all greeting you. Everybody's happy now, happy now, happy now. Everybody's happy now. We are all greeting you.